Okay, once again, welcome everyone to this webinar on the importance of data disaggregation in humanitarian context. This webinar is going to be recorded and will be available for distribution in the afternoon today. My name is León. I am the FDRS administrator for the Americans. Okay, everyone can hear, perfect. All right, so let's talk about data disaggregation. The world has gone under significant and rapid change in recent years. The role of data has changed, and data has become the center of decisions in the sector. All humanitarian organizations seek to become data-driven organizations. Data is perceived as indispensable when making decisions. Data and information obtained from it can improve communication, coordination within the Red Cross and Red Crescent movement, interagency coordination, and most importantly, help save lives. Now, what is data? We all know what's data, or we think we know. When we're working with data and information, it is extremely important to be clear on the concepts, however basic they may seem to us, to ensure that we are speaking the same language. According to the data playbook, data is defined as a discrete pieces of information such as amounts, prices, measurements, dates, names of places and people, addresses, and also as facts and statistics collected together for reference or analysis. Data is everywhere. Data is naturally messy and lacks sense because, as I mentioned, it's just pieces of information scattered all around us. Data, however, can be structured, can be processed, and can be put in an orderly way. This tells us a story and makes sense. When we do this, we transform data into information. Information is made up of data that makes sense, which means that data must be interpreted, processed, analyzed, or presented to become informative. Now that I talked about what data is, I have to talk a little bit about standards. Standards are a criteria, a method, a model, a pattern, a template, or a framework to help assess and make judgments on quality and accuracy. In the humanitarian world, we have data standards that are similar across all organizations. For example, we all have indicators, reports, measures. We all have to deal with financial management numbers, data analysis, audits, among others. Now, the standards allow us to measure our data. It allows us to share it, to make it comparable between different actors. It allows for transfer of information between peers, either within the movement or with external partners, such as United Nations agencies and donors. The standardization of data allows us to save working hours and to be more efficient in the coordination, comparison, and measurement of our data, and consequently our scope and our impact. One example of how standards help the humanitarian world is through the dynamic collaboration between the International Federation and OSHA's Humanitarian Data Center. Following humanitarian standards of HXL nomenclature, the International Federation shares data sets, meaning organized data, which can be accessed by other organizations for analysis. They can be used as a baseline at the start of a humanitarian project or an operation. Among the data sets shared by the International Federation is an aerial mapping of the impact of Cyclone Idai. This is the most downloaded data set. It has been downloaded 197 times. Now, we in the Federation also have data sets, data platforms. The first one is the Federation-wide Data Bank and Reporting System, also known as FDRS. The data bank provides information on the world's largest humanitarian organization. We have information of 190 national societies. Each national society reports on key indicators that refer to the number of volunteers, paid staff, people reached through actions in disaster response, long-term programs, and different areas of focus, such as disaster risk reduction, livelihoods, shelter, health. water, sanitation and hygiene, migration, protection, gender and inclusion. Besides these indicators, there are also the annual reports, strategies, and finances. This is made with the aim of creating greater transparency and accountability. Besides the information contained in the data bank, the FDRS team, of which I am a part of, also makes an annual global report with in-depth analysis of the overall information collected. The next issue will be available on the website on July 18th. Another data platform that we have in the Federation is the GO platform. The GO platform contains information on disasters and emergencies where the International Federation and national societies have interventions. It provides universal access and information for decision-making. The information is gathered from response personnel and volunteers in the field and matched with secondary information from our humanitarian partners. What you see right now on the screen is an example of an interactive map that shows interventions in the Americas. Now that I have talked to you about a few definitions, we have finally reached the core part of the webinar, data disaggregation. As I mentioned before, the humanitarian world has been stirred up by data. Big data, it's the rage right now. It's what's being used by everyone to make decisions. However, data collection is the foundation and is the basis of all the information that can be obtained by using data. When we have good data, we can create interactive dashboards and we can influence decision-making and allocate financial, physical, and human resources where they are needed. When we talk about data, we often talk about numbers and facts and figures, and sometimes we forget that the people are the center of the humanitarian world. Our mandate as a movement is to alleviate human suffering. To achieve this goal, we need to take people into account. We need to take the vulnerable people into account. We need to count them. We need to enter their data into data sets so that that data that is transferred into information reaches the hands of decision makers. If you only provide a total, for example, if we're talking about a community that has 500 people, and we only provide the total, we do not know how many children, how many older adults, elderly, pregnant women, people with disabilities are within that total. We are making them invisible on the eyes of decision makers and to our organizations. If we don't know how many are the most vulnerable or how they are vulnerable, we will not be able to include them in the levels of disaster preparedness, mitigation, and interventions. Now, before I talk to you about some important subjects in data disaggregation, I want you to look at the following image. Read it and think about it. This image represents a problem when we don't have visibility. The two persons at the top did not have disaggregated data by disability, and therefore the person in the wheelchair has become invisible to them and is not able to access the services that are provided because there is not a ramp or another way of accessibility in the place. Disability. There is currently a high incidence of disability in the world, and it's on the rise. There are more than 1 billion people with disabilities in the world. This corresponds to 50% of the world's population. Actually, any one of us can join the family of people with disabilities at any stage in our lives. It usually occurs as we age. However, it can occur due to other factors, such as traffic accidents, natural disasters, man-made disasters, conflicts, wars, diseases like diabetes, substance abuse, among others. The International Federation of the Red Cross and Red Crescent Societies has adopted a strategic framework about inclusion of persons with disabilities in the movement. This framework defines disability as a complex, multidimensional, and dynamic concept that has evolved significantly over time. It is the result of the interaction between the person with impairment and enabling or disabling characteristics of his or her socio-economic environment. Strategic objective number 2 of this framework emphasizes that people with disabilities have equal access to the services and programs provided by the movement. Although the framework was signed in 2015, much remains to be done in the area of inclusion. Now that we talked about what disability is, I want to talk to you about what persons with disabilities means. According to the UN Convention on the Rights of Persons with Disabilities, it defines the following. Persons with disabilities include those who have long-term physical, mental, intellectual, or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. This definition is the same definition used in the Red Cross and Red Crescent movement to define persons with disabilities. This convention was signed in 2006, reflecting that the humanitarian world in general has a lot of catching up to do when it comes to the inclusion of persons with disabilities within their programs and their reach. Another subject that I want to talk to you about is sex. Crisis affects women, men, boys, and girls in different ways. Men and women have different needs and different concerns, as well as different ways of coping with crisis. Whenever there are emergencies, these exacerbate differences between the sexes, and incidents of sexual and gender-based violence generally increase. Our commitment to ensure and protect human dignity through alleviating suffering and promoting non-discrimination and respect for diversity can only be achieved through the use of information from disaggregated data in order to carry out inclusive planning and correct the route along the way if necessary. Okay. Please mute your microphones. Thank you. So moving on, why am I talking about sex and I am not talking about gender? Sex and gender are different words with different meanings. Sex refers to physical and biological differences, usually between men and women. Gender refers to social differences between men and women during their lives. Although they differ depending on the culture, these social differences between women, men, and people that identify as other gender identities may change over time and are different even within the same cultures. Gender determines the roles, the power, and the resources that are allocated for men and women within the cultures. By disaggregating data by sex, gender analysis can be supported. This helps to understand how a person's gender affects opportunities and barriers at a given time. Since genders depend on culture and can change and are very dynamic, information is collected by sex, which, as its physical characteristic, is comparable between other organizations and with government data. Age. In addition to sex, disaggregation of data by age deserves also special mention. Since project teams generally have questions regarding how to disaggregate age groups, there is no absolute set of disaggregating persons by age. However, humanitarian operations are guided by the SPHERE project, and we shall see this disaggregation later. It is important to bear in mind, though, that age disaggregation will also depend on the type of program being provided. If we're talking, for example, about a vaccination program for children or a nutrition program for children, it might be necessary to detail the ages at lower intervals than those recommended by the SPHERE Handbook. So, summarizing what we mentioned, segregated data can help us in adapting services, adjusting the way, showing our impact, and improving our accountability. Now, how do we achieve this? How do we disaggregate data? We do it through SAD, sex, age, and disability disaggregated data. Disaggregating people means counting reporting on people according to different categories that help us better understand who we serve and adapt our programs to better serve them. This is the first step in understanding who we are going to reach and who we are not going to reach. It provides a broader view in order to reach the target populations. In the same way, people reached must be disaggregated when measuring our progress and also at the end of the program to measure the impact on the communities. The categories used are generally socio-demographic characteristics, for which SAT is an excellent tool, since it includes sex, age, and disability according to 6 areas: walking, seeing, listening, cognition, personal care, and communication. Data disaggregated into socio-demographic characteristics have a considerable influence on service delivery and program outcomes. The fact that SAT only includes sex and not gender does not mean that national societies and programs cannot collect such information. There are many cases where detailed information on gender identity and sexual preference, for example, can positively or negatively affect the impact of our services. Let us remember that protecting people's dignity and do no harm is one of the main pillars of our humanitarian work. Now that we have briefly touched on the issues of disability, sex, and age, let's look at the tools we have to collect this type of data. We have several tools. I'm going to talk to you about 3 of them. There's the Sphere Handbook, the Washington Group Questions, and the technical note for counting people reached. The International Federation uses the Sphere Handbook as the minimum set of standards for humanitarian response. As you can see, this is a table that comprises all 3 elements that I mentioned: sex, women and men, disability situation, person with disability or without disability, and then we have different age brackets. 0 years to 5 years for infants, 6 years to 12 years for children, 13 to 17 years for adolescents, 18 years to 29 years for young adults, and then we have 10 age brackets for 30 years old, 40-year-olds, 50-year-olds, 60-year-olds, 70-year-olds, and then 80-year-olds plus for elderly. This is a table that can be used in programming and when collecting data. The Washington Group Questions is another tool that I want to talk to you about. But first of all, what is the Washington Group? The Washington Group on Disability Statistics is a UN Disability Statistics Commission. It's comprised of 3 people, and its goal is to develop and test tools to collect internationally comparable disability statistics and to help stakeholders identify people with disabilities. The Washington Group has developed 3 types of products. There is the short set of questions on functionability, which are 6. There is the extended set of questions on functionality, which are 37. And then lastly is the child functioning question set, which was developed with UNICEF. This one is separated in 2 subsets, one of 16 questions for infants of 2 to 4 years old and 24 questions for children and adolescents from 5 to 17 years of age. These questions are not made to the children. These are meant to be asked to the tutors, parents, or carers of children. The Washington Group of questions are standardized. They allow us to measure data that can be comparable with others. They have been tested. They avoid prejudice and stigma. They can be adapted, and they allow for rapid assessment of the situation. The reduced set of functioning questions, the ones with 6 questions, has been extensively tested, and it has been also adopted as a minimum standard for identifying persons with disabilities. This set of questions is going to be used in many of the 2020 round of censuses that will be conducted in several countries around the world. In addition to this, the set of questions has been supported by a group of experts from the United Nations as the method of assessing the Sustainable Development Goals regarding disability. So I want to talk to you about the short set of questions. As I mentioned earlier, there are 6 questions. Do you have difficulty seeing, even if wearing glasses? Do you have difficulty hearing, even if using a hearing aid? Do you have difficulty walking or climbing steps? Do you have difficulty remembering or concentrating? Do you have difficulty with self-care, such as washing all over or dressing? And finally, using your usual customary language. Do you have difficulty communicating, for example, understanding or being understood? We have to take into account that disability is a complex issue and that these 6 questions do not cover all aspects of difficulty in functioning, but they can provide a quick identification of the most functional of disabilities. However, when more detailed information is needed, then we have the extended set that includes information on upper body functioning, psychosocial difficulties, pain and fatigue, and additional information on domains of functioning with and without the use of assistive technology, such as wheelchairs or hearing aids. Now, these 6 questions are not open-ended questions. There are only 4 answers to give to these questions. No, no difficulty, yes, some difficulty, yes, a lot of difficulty, and finally, cannot do at all. These closed-ended questions facilitate both the time of collection as well as the measurement and comparison of the answers. The 6 questions are meant to be asked in 1 minute. Now, there are some considerations regarding the Washington Group questions. There's a time constraint. I'm not talking about the minute that it takes to ask these questions. Since we're talking about sensitive information and a subject that in several cultures is taboo or that it can lead to discrimination and exclusion, enumerators should be trained on how to ask these questions correctly. They should be trained on what to say, what not to say. And this is the most important part of the data collection. The people that are asking the questions should have a good knowledge of how to ask them. The Washington Group has a manual on how to train enumerators. It has also the sets of questions on their website, and additionally, it also has the explanation of why these questions were thought of. It's always preferable to use the Washington set of questions rather than letting the volunteers or collaborators check the disability box according to what they see. Since we must remember that there are different types of disabilities and they are not all easily identifiable by just looking. Another constraint that we have with the Washington Group questions is that some countries have data protection laws that do not allow us to ask information regarding disabilities. And then the last tool that I want to talk to you about is a technical note on counting people reached. This is a guide by the Red Cross and the Red Crescent Societies Federation. It's a simple guide geared toward programs teams and project teams. It's made with the target for everyone, not only the teams, but it shows how to count people correctly. Counting people can be difficult, and this technical note responds to the demand of staff in the field for counting people. It allows for proper data collection that is based on evidence, that will help decision-making, that will help learning, and will help with accountability towards ourselves, our peers, the people we serve, and our donors. It is important to remember that even though the Federation has guidelines, donors may have their own requirements regarding data disaggregation. And now I'm going to give the floor to my colleague Paula Martes, PMER Manager of the Americas, who will explain the new pledge-based report format.
Good morning, everyone. Thank you for attending this webinar. It's a pleasure for us to be talking with you about this important matter. To continue to the ideas that my colleague Maylene has been sharing with you in the last half an hour, I'm going to present you briefly a new template for reports that we are launching within the movement. The template is called the Pledge-Based Report. Basically, this is the template that we use to do the reports against the contributions that we receive for different donors for emergency operation or programmatic interventions. Why I'm sharing with you this template? Because this template is a good example of how all the information and all the theory and tools that Maylene has shared with you is being used and is being requested to be included in the different reports that we are submitting to the different donors or to the different channels where we are accountable of our actions. So what is new in this Pledge-Based Report? The Pledge-Based Report that we are using now has a less number of sections to avoid duplication of information. And more importantly, the new template has a specific section for CAA, we are going to combine all the activities that we are doing within the communities to be accountable with them about our actions and how we ensure that the communities are included in the program, design and also in the program intervention. Also, this template has a space to be accountable of our exit strategy and visibility. What are two main points for our intervention, whether we are going to be accountable or be more vocal about, even though our intervention is ending in a particular community, how our actions are going to be maintained and going to be continued with the structure that we left in the community. But what is more important and is more related with this webinar is that this template is requesting now that we need to put disaggregated data about the people reached during our intervention. And this data is requested to be disaggregated by sets and by age groups. So in order to be able to report the information at this level of disaggregation, we need to be aware about why the data disaggregation is important and what tools we can use in the field to guarantee that we are collecting our information since the beginning of the intervention with this level of disaggregation. Why we are including this? This new Pledge-Based Report was made based on a consultation process with different donors and different stakeholders that the Federation and the movement have around the world. So this Pledge-Based Report is now aligned with the different information and data requirements that different donors and organizations are managing at global level. So now, from now on, we need to put this kind of information when we need to use this Pledge-Based Report. This new template was approved since the beginning of the year. So here in the Americas, we have been committed to carry on a rollout process. So we started this rollout process since May when we sent the template with a bunch of focal points in the region. And then we have managed to have different spaces to share this template with our PNSS that are having interventions here in the region. And also we have a webinar with the union clusters to have the technical teams aware of this new template and these new reporting requirements. And we had in our rollout process the importance to have a webinar with different people from the different national societies to be aware of this new Pledge-Based Report. since when we have a different, whether programmatic or emergency intervention, the national societies are the ones that are implementing the action. So needs to be aware that it's more important now to have this kind of disaggregated data. And so in order to do the process more organized, we have decided that all the new pledge or all the new contributions that we received since June 2019, when they are signed, they are going to have this template. If the donor or if the organization is requesting a standard narrative template, because you know that we sometimes need to submit a reporting template requested by the donor. So that's why we are doing the roll-up process for this tool. But it's not only important the data disaggregation for the reporting part. The main objectives that we have with this webinar was to create awareness why it's important to have data disaggregated of the people that we are reaching. And that's why, as Mei-Lin has said, that's why because we are going to make more visible all the different characteristics and all the different the difference that we can find within a population group that we are going to intervene. So it is important to be aware of the data disaggregation tools in a manner that having this information and having this data will make us as an organization more aware and more and we can produce more or take more decisions based on facts and based on the actual needs that our populations and our communities have. So that was the main point of our webinar, was to create awareness of this and was to share with you these important tools. And we remain available for you in case you have any questions or you need any technical guidance about how you can ensure that during your intervention you are collecting data at this level of disaggregation. Also, as we have mentioned, we have created a list with useful links with all the tools and all the information that we have shared with you during all this presentation. Here you will find a very extensive list of all the tools and all the tools that we have mentioned before, including the pledge-based report that I mentioned briefly. And the idea is that you have access to all this information and can be able to read and to review. And in case you have any questions or you need any clarifications, you can contact us and let us know. We are more than happy to help you with this. So I think that now we can open the space for questions or comments from the colleagues. So let us know if you have any question or comments. We are here. Remember to unmute your microphone if you want to make an intervention, or you can put it in the chat also. I think that we don't have any questions from the colleagues. I hope that everything was clear and there is no any question. Okay, what we want to mention to you is that yesterday in the Spanish version of this webinar was agreed to have another webinar regarding data protection. So we will let you know the date and time for this new webinar. The reason why we are opening the space for this new space about data protection was that it's a very important issue.
Yes, and the IFRC recently rolled out its guidance regarding data protection. These are going to be approved in the next General Assembly at the end of the year. So we're going to be doing a lot of advocacy into explaining how this affects our work. We will also have the webinar in English, and we will be letting you all know the date.
Yes. And the main focus on this webinar, where we will be able to give a general idea about data protection. We are going to be more specific about data protection in migration context. So we are coordinated with key focal points here in the office that are being involved in the last migration operation, the large migration operations that we as organization have now currently active in the region, in different parts of the region. So we will let you know, because we saw that this is a thematic that is very related with the data disaggregation thing. And also, but we don't have date and time for that there is also an interest to roll out the new protection, gender, and social inclusion toolkit. But that is something that is being coordinated by our PGI focal point here in the region. We will let you know when we have the day and time for the presentation of this new toolkit that is very related with the importance of data disaggregation as well. So if there is no more questions, we want to thank you all for your participation. Yes, we have a last comment. I think I shared it. We should thank you for providing the distinction between sex and gender, as too often we still see reports where individuals are unaware of the difference between these concepts. Gender is a sociological construct, while sex is a physiological characteristic. Thank you very much for that comment. So thank you, colleagues, again for joining us. And here you can find our email address.
Our contact.
And yes, and you can contact us.
Thank you, everyone, for attending. We will be sharing with you this presentation as well as the recording. Feel free to share it with all of your contacts. And thank you very much. We will be letting you know when we have the other webinars, when we have the dates. So you can also share this information with them. Thank you very much, and have a great weekend, everyone.